Today is January 16th. I'm Eric Feaster, Professional Development Coordinator for Maryland Department of Health's Developmental Disabilities Administration. We welcome you to Eastern Shore Regional Office's Regional Quarterly Webinar. On the panel today, we have Kim Gescheidel, our Regional Director, and we also have Christina Dixon, Executive Director of Liberty. All participants are in listen-only mode. If you look at the panel interface in the upper far right corner, there are two tabs to notice. The first tab is the settings wheel, where you can select computer or phone audio. The second tab moving left is the question box. At the end of Christina's presentation, you can type your questions for Liberty Healthcare. Then towards the end of the entire presentation, we will take additional questions that relate to the DDA. The third tab moving left is the paperclip icon, which represents the materials. We have a PowerPoint loaded for you in this section. If you are listening by phone, you can request that presentation to be emailed. We will be recording the webinar, posting this session on YouTube and the DDA website. And now I'd like to introduce Kim Gescheidel, our Regional Director. Good morning, Kim.
Good morning, Eric. Thank you so much. Welcome and Happy New Year. We are delighted to be resuming the DDA regional provider meetings, and we really appreciate you joining us this morning. With me for today's presentation are Rachel White, Deputy Regional Director, Debbie Balea, Director of Community Services, Renee Benjamin, Fiscal Director, Naomi Holocaust, QE Regional Nurse, Director of Provider Services, Andrea Jones, and Caroline Bailey, Director of Quality Enhancement. And I know you all know folks, but it's nice to see everyone this morning. And they will be available for responding to questions and reading slides. So at this point, they will be going off camera. All right, I'm going to turn it back to you, Eric, so that Christina can share all the great information from Liberty.
All right. How you doing today, Christina?
Doing great. Thank you all for having me this morning.
Is everyone able to see the presentation?
I am not able to see it yet, Eric.
No.
A second, my apologies.
No problem. There it is. Yep. Thank you, Eric. And there is a little bit of background noise. I don't know if that's on my end. No.
Yes.
Is everyone muted? Okay.
Everybody needs to mute.
I'll make sure mine is muted.
Okay. Thank you, Eric. I'll get started. Good morning, everyone, and thanks for joining the Eastern Provider Meeting this morning. We're here to provide an update on person-centered excellence evaluation activities that Liberty's conducting. And I think a lot of us know each other, but I am Christina Dixon, the Executive Director for Liberty Healthcare, DDA's Quality Improvement Organization. Next slide, please. Thanks, Eric. So today we're going to take a look at what the data can tell us And first, we are going to take a look at the system compliance data that's been collected. And this is for monitoring of waiver assurances. So the performance measures in each of DDA's waivers. And what that data collection tells us is to what degree are DDA standards being met. You all know this, but just as a quick reminder, the way that we collect the system compliance data is through qualified provider, claims, critical incident and restraint investigations, level of care, and person-centered plan reviews. So we look at each of those things as we compile the system compliance data. Next slide, please. And what we are going to look at today is data from January through March of 2024. And again, these are the waiver assurance results. And we wanted to kick it off this morning with the performance measures that are meeting or exceeding compliance. So what are those areas that we're doing really great in Maryland? And then the next two slides are also going to show some additional performance measures where we might be either emerging, coming really close to compliance, or also falling a little bit below compliance and want to put some efforts in place to increase those. But let's start out with what we're doing really well. So initial level of care, the process including timely and completed comprehensive assessments for new enrollees. And that is often meeting compliance at 85% or higher. And we're also seeing meeting compliance is that participants have a choice of waiver services and providers. And right now, the way that we know this is through the person-centered plan signature sheet, indicating that the person has had a choice in providers and waiver service. We also see that the Office of Healthcare Quality Investigation and timeliness and completeness for incidents is meeting and exceeding the compliance above 85%. And then financial accountability of traditional and self-directed claims reviews. Those are a very high level of compliance, up in the 90s, and similarly, billing compliance for coordinator of community services billing is also a very high level of compliance on a quarterly basis. Next slide, please. And this slide's going to show us emerging compliance. So those things that are really close to hitting that compliance mark and maybe with just a little bit of strategies put in place could actually get above the 85% compliant mark. So initial level of care determinations being completed prior to waiver services. That's almost in compliance. And then additionally, redetermination of level of care completed timely for current waiver participants. Also is in the emerging compliance area. Staff meeting all training qualifications for dates of service of claims that were reviewed. So we are seeing that is close to that 75% mark on a quarterly basis. And participant annual service plan timeliness, meaning that the plan was approved prior to the annual service plan effective date. And then critical incidents being reported on time is also within that 75 to 85% range regularly. Next slide, please. And then here are some indicators that we are seeing that are falling below compliance currently. So providers that have all licensing and certification documentation submitted timely and completely to the DDA prior to their renewal. Participants individually assess needs being addressed in their service plan and their goals being addressed in their service plan. is falling below that 75% rate. Participant service plans where services were delivered in the type, scope, amount, duration, and frequency that it was listed is currently below 75%. Coordinators of community service monitoring visits for timeliness and completeness, so meaning that all of the required monitoring visits during a PCP year occurred and were timely. And coordinator of community service monitoring of participant progress towards outcomes is also below that 75% indicator. Annual health risk screening tool, timeliness and completeness, and proper procedures followed for unauthorized restraints. And so the monitoring of performance measures that we just took a look at help us to ensure the minimum access and delivery of home and community-based service waiver programs. But in addition to those measures, we also want to think about ways to build and measure quality so that we're sharing so we are going to share a few resources with you today, and that's what I have on the next slide for you. Thanks, Eric. So here, we want to think about ways that we can support people to be thinking about giving us better direction on how they would like us to provide service to them and support community life. So this is an advocate guide created by the Council on Quality and Leadership, and it's a tool that you can use to gather feedback directly from people you support about their experience receiving services from your organization. Many of you, I know, conduct an annual satisfaction survey with the people you support, and this is a tool that could be used to help you develop or expand your current satisfaction survey. And you'll see here that there are questions about integration and access to the community to help you gauge how that's going for people. And on the next slide, we have some additional questions. So also here, part of the guide are questions to help understand people's experience related to rights and having personal space in their home. And on the next slide, we also have information that helps to gauge independence and people's perspectives related to that. So not only does this advocate guide help to ask questions about people's integration, access to the community, rights, and independence, it also has material that will help you to educate people that you support on what the home and community-based settings final rule is and how it applies to them. Because we know that people being informed about the rules and regulations that affect them is also important. And so there is a section of this guide that includes that as well. And on the next slide, you will see a link to CQL's website where you can access this guide. It's free on their website and is something that's available to you all. We've also had a few questions about having this guide available in Spanish. It currently is not, but we are working on a version of that. And so if you are interested in a Spanish version of it, my email will be on the last slide of the presentation. You can shoot me an email and I'll add you to that list of people who would be interested in that once it's available. I'm hoping to have that ready for you all in the next couple weeks. Okay, next slide, please. So today we are also going to take a look at system quality and participant outcomes. And we gauge this through network accreditation activities that the Council on Quality and Leadership has certified us to conduct. And so those data collection activities are done through the basic assurance reviews of providers and through personal outcome measure interviews with participants and people who support them. And so the basic assurances reviews with providers tell us to what degree are systems and practices in place to support person-centered excellence. And personal outcome measure interviews help to tell us to what degree are personal outcomes of participants being met and supported within our system. Next slide, please. Thank you. So, this slide is going to tell us a little bit about, are people supported to have friend and family involvement in the way that they prefer? And sometimes we also call friends and family natural supports. So here, the first two pieces of data are from our basic assurance reviews. And what we see is that 35% of organizations have a system to identify, engage friends and family, while 60% of the time practices are seen within an organization that identify and engage friends and family. And so what this means is that 60% of the time, staff, supervisors, leadership within an organization are engaging in behaviors that promote natural supports. However, less frequently, we see at that 35% of the time that there's actually a system, whether that be a policy or a way to train your staff on how they should be engaging with natural supports and friends and family. And we see that those systems are important to put in place because it helps to boost the percentage of time that organizational staff are engaging in those practices. Related, we also see that 26% of people who participated in a personal outcome measure conversation were connected to friends and family in the way that they preferred to be. And then 18% of people who participated in a personal outcome measure conversation had supports from paid services to connect with friends and family in the way that they wanted. So, when thinking about individualized support and outcomes people want related to friends and family or natural supports, we must first ask the person who is important to them and how often they want to connect with the person and in what modes do they want to connect with the person. Organizationally, there are also some questions that we can ask ourselves. So, one, do we recognize the value of natural supports in people's lives to promote identity, personal security, and continuity? And do policies and practices reflect how our organization promotes natural support networks for continuity in existing relationships and new ones? Do policies and practices reflect how our organization assists people to access their natural supports? And lastly, do staff receive, oh, I think we just lost the presentation. Thanks, Eric. And lastly, do staff receive training to support people's families and friends to communicate with them or keep in contact and maintain relationships? And then we could go to the next slide. So we want to make sure as an organization we're identifying who is important. And it's important to have a system within your organization to work with people to identify that. Also, we want to be able to identify what method they prefer to communicate with a person and how often they'd like to that communication to occur within that specific relationship, because that could be different relationship to relationship. And so on the right-hand side of this screen, you'll see an example of what one organization in Maryland did to set up a system. You could consider adopting this and modifying it within your organization. And I want to point out that this natural supports identifier that you see here is homegrown in Maryland by Gallagher Services. Gallagher shared this with us as part of their basic assurances review and are allowing us to share it with you today. Next slide, please. So what else could be important to people? Over here on the right-hand side, again, is another part of the natural supports identifier where it's also identifying not only the people, the mode, and the frequency in which they would like to communicate with someone, but it's identifying important dates. To someone, whether that's birthdays or anniversaries or memorial dates. These are oftentimes points when we reach out to important people in our lives that we maintain relationships with. And by knowing these types of dates and which ones are important to the people we're supporting, we can also help them to facilitate similar types of connection. And then on the left-hand side here, we have a quote from the Council in Quality and Leadership that I wanted to share with you. So personal connections are natural safeguards that promote people's health and safety. And data from the personal outcome measures establish a link between health and safety and people's connections to natural support networks. These connections have been shown to prevent abuse and neglect and to promote health and safety and personal security. These ties that bind are links to the greater world that create a blanket of security that internal organizational supports cannot duplicate. And so, as you can see, when people have friends and family and other natural supports, they're more likely to have outcomes of health, safety, and access to their community present in their lives. So, if you're interested in receiving a copy of Gallagher's Natural Support Identifier to help people within your own organization and create that system, you're welcome to reach out to me at christina.dixon@libertyhealth.com. And my email, again, will be on the last slide here, and I will be happy to share that resource with you. Next slide, please. And then lastly, we are also going to take a look at a little bit of data related to participant family and voice that's also connected to natural supports. And we collect this through National Core Indicator surveying. And these are responses specifically today that we'll be looking at that are from participant responses in the National Core Indicator surveys. And it helps to tell us to what degree are participants experiencing quality services and supports. Next slide, please. And I want to point out that the responses that you'll see here on this slide are from the 2022 to 2023 survey cycle, and again, are responses directly from participants receiving waiver services. So what we were told was that 89% of the people surveyed had access to the internet. However, only 65% of people were using the internet daily. And 38% of people who responded to the survey used technology in their everyday life to help do more things on their own. Also, 78% of people have a cell phone. And of the people who don't have a cell phone, 55% of them would like one. And that is actually a little higher than the national average of 47% of people who generally fall into that category. So we should think about using this information to recognize what people do and do not have available to them related to technology, and to help people set goals as they desire for additional access to technology. We know technology plays a critical role in people's ability to connect in the way that they prefer with the people that they want to connect with. And increasing access to technology can help people have increased safety, security, and community connection. Next slide, please. And so that's the end of our presentation today. I did want to share with you that for additional information, you can access the Quality Improvement Organization webpage on DDA's website at this link, where you'll find standard operating procedures for each type of review that we conduct on behalf of the DDA. There will be additional resources, newsletters, and data summaries and reports for your review. And then on the last slide here is my contact information if you're interested in any of the resources that we talked about today. I also, as I mentioned earlier, just want to reinforce that Gallagher did generously approve the sharing of the natural supports identifier. They've also approved the sharing of a few other resources that they have. So they have a Me and My Rights informational document, a money skills assessment, and a rights assessment and safety and supports assessment. And each of these documents help and are aligned with person-centered practice that organizations can use to create individualized supports and promote outcomes with people. So if you're interested in any of those, reach out to me via email. We'll make sure that you can get those. And just as a reminder, the advocate guide that we looked at is available on CQL's website publicly. And thank you all for having me today. I don't see any questions in the chat, but as we go through the remainder of the presentation this morning, if there are questions, feel free to submit them in the chat. And if we don't get a chance to answer them before the end, I'll be happy to follow up with you via email. Thank you all for having me. Oh, thanks, Sandy. I see that you put a question in there. Do we have numbers specific to Eastern Shore? We do have data for most of our reviews that is specific to the Eastern region. I don't have that on hand right now. However, that's something I will take your email and see if I can follow up with you to give you some specific information. If there's specific topics that you're interested in, you can let me know that too. Thank you.
Okay, thank you, Christina. And now we're going to hand it over to Kim. I'm going to go ahead and move the slides back to the beginning of the presentation for Kim.
Perfect.
Okay,
Thank you, Christina. Perfect. Thank you. Okay, next slide, please, Eric. Okay, so this is, I wanted to let folks know, first and foremost, this meeting is being recorded. The other regional provider meetings have also been recorded. So if at any point you want to go back and review the presentations, they will be provided to you. Additionally, when there are questions and questions that we may be preparing responses for you, they will be consolidated into one response document for all of the regions. So just so that you know that ahead of time. This is a standing agenda that will be used for this and subsequent provider meetings. So we'll be reviewing leadership, statewide provider services, federal programs when there is information to share, which we do not have information for today's meeting, fiscal, LTSS Maryland, DDA budget hearings, Liberty Healthcare, and then regional office specific information. Next slide, please. Next slide, please. So we are very happy to announce that we've had several new folks who have joined our DDA team, specifically Antoine Williams, who has joined as the Director of Programs, and he is located at headquarters. Patrick Ubaja, who is with CMRO as their Provider Services Director, and Sean Haynes, who has joined the Western Maryland Regional Office team as the Provider of Services Director there. We hope that you'll have an opportunity to greet and welcome each of those individuals at some point. Next slide, please. Okay, so there are a number of points that we wanted to share, updates related to the provider services. So there will be an upcoming change to the requirement for certified and licensed providers to submit provider renewal applications, and it will be every 3 years rather than annually beginning April 1st. Next slide, please. So to accomplish this 3-year renewal process, DDA providers have been randomly assigned new renewal years so that there will be a staggered rollout so that not all providers will be renewed within 1 year. You will receive a letter indicating your new renewal date. Letters will be mailed out between January and February. And then following this date, providers will be required to renew your certification or licensure every 3 years. For licensed providers, the Office of Healthcare Quality's licensure interval for licensed providers will mirror the DDA licensing date changes. So they will issue licenses every 3 years at the same time as the DDA certification, and they will continue to conduct annual surveys of all licensed providers. And please note that COMAR 1022-0202B requires that applications for renewal of certification licensure must be submitted at least 60 days prior to the renewal date. And this is really, really important. You really do need to be sure that you have submitted your application for renewal in advance of 60 days. Failure to do so may result in non-approval of your renewal or licensure, and there could potentially be other actions that would be problematic for you. So please, please, please do make sure that you do submit at least 60 days prior. The 3-year renewal will be required for all DDA providers, with the exception of the children's residential providers. Their requirements are outlined in a different place in COMAR in 14310505C. Next slide, please. Okay, everybody's favorite topic, ePrep. So we wanted to make a note here that for new providers need to submit an ePrep application in order to receive a new base MA number and a new site MA number. For current providers, any supplemental changes or updates, new sites, etc., or revalidations are what you would need to submit to ePrep. And the revalidations are typically every 5 years. In terms of important reminders, please make sure, and I know a number of you have discovered how important this is, your pay-to address must match your W-9 exactly for every single site within your agency. This includes abbreviations and +4 digits of the zip code, and this will go a long way in avoiding billing issues in the future. And I think if there's any way that you can take an extra look at your information before you submit it for your ePrep to be sure that this is all completely accurate, bring somebody else in to take a look at it before you send it. I think it will save a lot of headaches moving forward. Instructions and a link to the addendum, which is PT90, can be found on the DDA website providers page. Next slide, please. Okay, so here is a picture of the required documentation, and in important reminders, make sure that the PT90 addendum accurately reflects what type of application you are submitting, also very critical. And instructions, again, as noted, we just want to be sure you have the right information. Instructions and a link to the addendum, which is PT90, can be found on the DDA website, Partnering with Providers page. And please make sure that all required documents that are uploaded are current, signed, and filled out completely. And the PT90 is required to be submitted with all types of applications. If you have any questions about that, please reach out to the Provider Services Director in our region. It's Andrea Jones. Next slide, please. For additional ePrep resources, they can be found at the Maryland Department of Health's ePrep instructions and training website that you see here. If you have questions about the ePrep portal or you need technical assistance, please contact the Medical ePrep helpline at 844-463-7768. If you have a DDA specific question, please contact dda.eprepReview@maryland.gov. So that's dda.eprepreview, no spaces, at maryland.gov. Next slide, please. Okay, so nurse required trainings. So the Senate Bill 405 and the DDA waivers require all RNs complete the initial 2-day case management delegation nurse course, which is RN CMDN. The regional nurses keep an active registry for all active RNs. If you have any question, please make a point of reaching out to the regional office RNs. To maintain active status, your RN must complete all required training as identified by the regional nurses. The upcoming initial RN CMDN classes will be held in the following months: January, March, May, July, September, and November. And you can find additional information on the DDA training calendar for more details on these classes. In addition, the Intellectabilities Fatal 5 e-learning training modules have been made available to all DSPs and RNs for free by DDA. And just to let you all know, now it is the Fatal 5 plus one, which now includes aspiration, bowel obstruction, dehydration, seizures, infection or sepsis, and GERD. As a bonus, How to Manage Choking, which addresses prevention and protocols specifically related to health conditions that can complicate choking, is available for free. These are such great resources, and I really want to encourage you, if you have not helped your nurses take advantage of these, to please make it a point to do so. Please double check the training calendar so that you have the most accurate and up-to-date information. If you have any questions, reach out to the regional office nurses. Next slide, please. So the HRST, next slide, please. So the HRST is reviewed for accuracy during nursing assessments, following hospitalizations, injuries, and any other changes in conditions. And this is just so important. Service and training considerations are identified in the HRST, and they should be incorporated into the nursing care plan and the risk section of an individual's PCP. There are no nursing support services, or NSS, identified in the waiver for standalone HRST review. All nursing support services include HRST review, and any HRST that requires a review must have a nurse identified to provide the nursing support services. Nurses are required to take the following HRST trainings: the rater training, the advanced rater training, the clinical reviewer training, and the DDA requires the HRST to be rated at least annually as conditions change, and to be clinically reviewed within 14 days of the rating. Next slide, please. Okay, so here are some reminders required under COMAR 1022-02-11C2 and COMAR 1022-05-02B5 for staff working with people with an identified swallowing disorder, an order for an altered textured diet and or behavior plan that addresses eating behaviors. Vaccinations for influenza, RSV, COVID, and pneumonia, if appropriate. 2 or more related cases of positive COVID-19 in people or staff members within 10 days in the same setting. The agency must submit an incident report in PORI. So RSV usually causes mild cold-like symptoms that resolve within a week. However, it can lead to more severe respiratory illnesses like bronchiolitis or pneumonia. RSV is most common in infants and young children, but can also affect adults, especially those with weakened immune systems or chronic lung conditions, and a number of the folks that we serve fall into that category. Hospital and nursing facilities discharge planning starts at admission. RN must assess and evaluate prior to readmission to ensure delegation can be met in the setting. Pre-admission screening and resident review, also known as the PASAR, is required for nursing facility level of care and does not replace agency discharge planning. Nursing care plan is developed by the RN after an assessment, and it provides simple, direct, concise instructions for what staff are to do related to health conditions. The staff work under RN direction and supervision in preventing, maintaining, or rehabilitation health issues that nurses have impact on. The NSS and DDA are nurse delegation, nursing care plans required, nurse health case management, nursing care plans required, nurse consultation. No nursing care plans, but a health protocol may be present. Next slide, please. And I meant to mention that the 33rd Developmental Disabilities Nurses Association Education Conference, which is a mouthful, for 2025 will be held in Baltimore at the Renaissance Baltimore Harbor Place Hotel, May 1st through 5th, 2025. Okay, so for this meeting today, there are no federal programs updates. So next slide, please. So fiscal and waiver updates. Very good. Okay. Individuals must be placed on a waive prior to completing any new waiver paperwork. I know you all have learned just how important this is. Individuals should not start services until waiver approval, and this is even more critical. Waiver documents, including bank statements submitted, should include all of the pages. Even if it looks to you like it's not particularly useful information, you must submit the complete bank statement. Program type, initials, and date should be at the top of the MA application. Please submit redetermination documents in a timely manner. LTSS is our client record, so documents should be uploaded within the system. And for EDD contacts, here is the information. I'm not going to read these to you, but I think you can refer back to this, and there is also a phone number, 1-800-226-2142. For in-client attachments, you would put the MA application for MA applications and redeterminations. You would want to access the financial section for financial supporting documents. Next slide, please. So for fiscal announcements. Okay, in April 2023, there was an LTSS enhancement which was performed, which now allows community living group home providers to see contribution to care amounts in LTSS, and you can review reports and export these files. To view CTC reports, authorized users should navigate to Provider Portal, then Reports, and then select and view a DDA Provider Portal Cost to Care report. Users can also click on the export icon to download the report. And here are some examples on how to do that. Next slide, please. So, congratulations and thank you for everyone's hard work in assuring that all of our providers across the state are fully transitioned into LTSS and have been as of September 1st. That was an enormous accomplishment. We cannot underestimate the amount of time and energy it took on your parts, and we truly appreciate your efforts. We want to thank all providers, coordinators of community services, and DDA staff who contributed to the success of this transition. It was truly a remarkable accomplishment. Next slide. Okay, so this is sort of timely. I just wanted to be sure, if you have not yet heard, that the DDA budget hearings, which are typically held right around the third week of February and are again this year, are as follows. The House Appropriations Committee in room 150 will be held Wednesday, February 19th, 2025. And the Senate Budget and Taxation Committee will be Thursday, February 20th, 2025 in the Amos hearing room. Next slide, please. Okay, so for our Eastern Shore Regional Office updates, I am going to turn this over to Naomi for a few nursing updates. Next slide, please, Eric.
Good morning, everyone. The client that you see before you, it summarizes the Eastern Shore Regional Office medical-related reportable incidents. We had 17 pneumonia, 11 UTIs, 9 COVID, 8 sepsis, 6 seizures, 6 fractures, 5 aspiration pneumonias, 5 med admissions, 5 failure to thrive, and 5 lacerations. The pneumonia vaccination is not just for individuals over 65 years old. Please be sure to ask the primary care physician about immunization for pneumonia, especially if the person has immunocompromising conditions such as a chronic renal failure, kidney disease, a person without a spleen, immunodeficiencies. So please also be sure that the staff are trained in personal care, including ambulation and transfers when it's indicated. Like when you see 11 UTIs, we need to make sure that the staff are trained in perineal care. Make participants home as safe as possible for ambulating and removing tripping hazards for those areas where you see fractures. Please consider a physical therapy or occupational therapy and home evaluations. So UTIs being the second leading diagnosis, staff, I can't say it enough, but staff need to be trained. They need to make sure the nurses are making sure that they're competent in what they're doing and how that they are taking the staff and making sure that they're in the right place and it's the right staff that's doing the training, and not only doing the training but also the person receiving that training, that they are well informed and capable of doing their job. Sepsis is a life-threatening condition that occurs when the body's immune system has an extreme response to an infection. It can lead to organ failure, shock, and death within 24 hours. Staff must be trained in signs and symptoms of infection and when to contact the RNCMDN. They need to know what changes to look for in that individual, how soon they should call. Be sure that the delegating nurses discuss these disease processes and the signs and symptoms with those DSPs. The DDA provides free training, and Kim's already said it and talked about the HRST for the Fatal 5+1 training. All DSPs and nurses should be taking advantage of that training, especially in bowel management, the aspiration, the sepsis infection. Contact me if you do not know how to get your staff signed up for taking that training, and I will be happy to assist you. If we can go to the next slide, please. So these are the top 10 hospital admissions that we have 7 diagnoses that are related to the Fatal 5. The UTIs, the sepsis, the seizures, dehydration, constipation, the aspirations, and the bowel obstructions. The Eastern Shore had 11 deaths this quarter. 4 out of the 11 were related to Fatal 5. So please, please, I can't ask you enough. Please get them into that training. That's it for me. Thank you so much. If you have any questions, please reach out to myself, Naomi Holoquist, or Ramona Bradley. Thank you.
Thank you, Naomi. Next, we have Caroline Bailey to speak regarding quality enhancement. Next slide, please. There we go.
Thanks, Kim, and good morning, everyone. This slide reflects some important incident categories that we want to highlight, and they're data for FY25 Quarter 1, and up until December 12th of FY25 quarter 2. As you can see, there were 6 allegations of physical abuse for quarter 1, 2 of which were substantiated. In quarter 2, there was an increase to 14 allegations of physical abuse, of which 8 were substantiated. One thing to note is that the substantiated physical abuse incidents in quarter 2 were due to people receiving services becoming aggressive towards each other, causing an injury. So we would have an incident report for each of those individuals, which would increase our numbers. But please make sure that your staff are aware of and fully understand the techniques outlined in a person's behavior plan to prevent incidents between people receiving services from happening. There was also a slight increase in allegations of psychological abuse in quarter 2, going from 3 incidents to 4. And the Eastern region had no incidents of abandonment in either quarter. And as you can see here, we are continuing to see incidents of neglect where people's staffing ratio levels are not being met. So in quarter 1, we had 51 incidents, and in quarter 2, we had 47 incidents. Please make sure that all supervisors are reviewing schedules to ensure that all 1-to-1 and 2-to-1 supervision needs are being met, and that staff are notifying their supervisor immediately if the staffing ratio needs are not being met during their shifts. And as a reminder, all reportable incidents should be reported within 1 working day of discovering an incident, and all agency investigative reports, or AARs, should be submitted within 10 working days. If anyone has any questions about incidents, please feel free to contact myself or Taylor Hartford, and we'd be happy to assist you. That's all we have for QE, though.
Perfect. Thank you, Caroline. And so now we will be moving on to questions.
So we have a question, I think, for Caroline. How is an incident report in PORI completed if there is not a person receiving supports involved?
So an incident report would not be. However, if it is an incident where a staff member is testing positive for COVID, they would be able to email our dedicated email address of emrotriage.dda@maryland.gov, and they would be able to let us know how many staff have tested positive.
Okay, thank you. And then I guess, Kim, for you, how many people are supported in the Eastern Shore region?
Well, that is a great question, Kelly, and we'll have to go back and double check and make sure we've got all the correct numbers for you. So we will provide that information in the Q&A response. But I want to be sure we've got the completely accurate number for our region.
And those are all the questions that I have in the chat box. Oh, Renee Cosmides is saying that registration for Fatal 5+1 has been challenging. Has that process been streamlined?
Naomi, do you know?
Yes, ma'am. From my
Thank you.
understanding, you send a list of DSPs, and your nurses should already have access because the fact that they have to be able to rate and review the HRST. But for your DSPs, you send a list to Adrienne Holloman, and then she will send that list on to the Intellectability and be able to have everyone registered. Renee, if you'd like to CC me in on any communications, I'll be more than willing to help in any way I can to make sure that your people get facilitated. And I do want to shout out to Eastern Shore Regional. You've done a great job. There was 114 total throughout the entire state for quarter 2. 57 of those came from the Eastern Shore. So you had half of what had been completed. So bravo to you guys.
Okay, we have a new question. Can you tell us anything about DDA's proposed budget?
Any questions regarding the budget, please contact Robert White at robert.white2@maryland.gov. Any other questions?
That's all
All
we
right,
have
so
in
our
the
next series of meetings will be are noted in the presentation here. And you can also get links on the DDA Connection newsletter in order to register for the Eastern Shores or any of the other regional provider meetings. Any additional questions before we close out for today?
Kim, I just had one comment. It's Debbie.
Yep.
I just wanted to give everybody an opportunity to say goodbye to our Maggie. Maggie has taken a position with another state agency, and so her last day will be Tuesday. I had sent an update out to the CCS agencies, and she reached out and networked with the providers, but I just wanted to make sure everybody had heard that.
Thank you for sharing that, Debbie, and we certainly wish Maggie well. We have appreciated having her here for 2 years and know she will do great things moving on. Any other questions, comments? Once again, thank you so much for joining us. It really means a lot. Have a great rest of your day. Thank you.